Hello, everybody. Thank you for tuning in, and I hope that you had a wonderful holiday season. If you got a chance to listen to our last episode about managing for the holidays, let us know if there are any tips that you found helpful, because we would love to hear what worked for you and what didn't. So, one of the topics that I wanted to talk about in this mini-sode was something that I mentioned briefly in the holiday episode, where I talked about how I was trying to eliminate plastic from my routine, and I got a little bit extreme about it. And it caused me a lot of distress, and I wanted to dig into this more to be able to talk about autism, its relationship with OCD, and how you can tell the difference when there is so much overlap. And so I think, especially if there are any clinicians out there who are listening, understanding this distinction from like a patient perspective or from a client perspective, I think is really important to being able to treat things that are distressing and leave behaviors that are helpful and beneficial. So let's get into it.
Welcome to It's Just ADHD. We're two curious ADHD coaches, and we're going deep on the how, the why, and the strategies to get through the difficult moments and how to make the best of life with ADHD. I'm John, and I've got an adult diagnosis of ADHD.
And I'm Tara, and I have a late in life ADHD diagnosis and an even later autism diagnosis. We're going to be diving headfirst into the messy and often complicated research around ADHD and autism. And we're bringing you along for the journey as we break it all down and make sense of everything.
Because sometimes it's just life.
And sometimes it's just ADHD. So OCD is a very misunderstood condition, very much in the same vein that ADHD and autism are very misunderstood by the general population. So you hear people make jokes all the time where they're like, oh, I'm a little ADHD today. I'm such a space case. I can't stop daydreaming. And of course, we know that that's not true. Not everybody is a little ADHD. And the understanding of the general public of what ADHD is and what it looks like is not really congruent with what ADHD actually feels like to those of us that have it. The same can be said of OCD. The same thing is true. People will make comments when they're like tidying up or when they're cleaning. Oh, I'm a little OCD. I'm a little OCD about this, meaning that they have a lot of attention to detail or that they're clean. And this is not actually what OCD looks like. So OCD is a very distressing and harmful condition to people who are afflicted. The behaviors are a lot more extreme than what the general population might understand. So much in the same way that like autism and ADHD, the traits are traits that everybody has from time to time. It's the frequency at which those things happen that makes it. So like with ADHD, everybody forgets their keys sometimes, but if you forget your keys every single freaking day, that is where it starts to become questionable. Like, does this get into ADHD territory? Similar thing with OCD. Everybody may do these behaviors from time to time, but when it's a daily thing, when it's a repetitive thing, when it's a distressing thing, that's when it starts to cross over into that clinical territory and when you would start to think about whether this is OCD. There are four main types of OCD, and pay attention when I'm reading these off, because for those of you who are more familiar with autism symptoms, I think you'll start to notice where the overlap and the confusion comes into play. Type number 1 is checking OCD. This is a very well-known type. The person feels like something horrible will happen if they don't repeatedly check stuff. So like if you don't repeatedly check that you locked the front door, or if you don't repeatedly check that you turned off the stove, then your house will burn down. Everybody has these thoughts every once in a while, like, oh gosh, did I forget to turn off the stove? And this has ADHD overlap. ADHDers might do some of this repetitive checking because you legitimately can't remember. And that's where the waters get a little muddy. But with OCD, it interferes with your daily functioning. You might be checking the locks to such an extreme that you run late to stuff, or that you can't do normal tasks because you're constantly checking. You might have to get reassurance from other people that you definitely turned off the stove, even though you went and checked 5 times, 10 times already. And so you're just always anxious about this. And so it's that anxiety, that underlying fear that starts to define that OCD territory. Another thing to point out here is that OCD doesn't always look logical. You can cognitively know that you locked the door, but you might still need to repetitively check. It becomes a habitual thing, and it doesn't necessarily map with your understanding of the situation. And so that's another area where you can start to disentangle it from ADHD checking. If an ADHDer knows that they locked the front door, they'll go on with their day. They'll forget about it. Whereas someone with OCD will still be thinking about it repetitively. So then a second type is contamination OCD. And that's like overwhelming fear of germs and contaminants. And so you develop rituals to try to like be clean. And so this isn't like, oh, I washed my hands the first time and I don't know if they're clean enough, so I'm going to wash my hands once more. This is every day, repeated. I've seen stories where people wash their hands so much that their hands get cuts and raw, scrubbing the skin so much that it becomes self-injury. It's to an extreme that people don't necessarily recognize or understand, or they might just avoid public places altogether. From a 1,000-foot view, when you see someone who's avoiding public places, there can be that fuzziness of like, is that autism? Is that OCD? So that's where it's really important to start to dig in. Why is this person avoiding a public place? Is it because crowds stress them out, or is it because they're afraid of catching a cold and getting sick? And that's where you draw the distinction between autism and OCD. So the third one, I think you're going to see a lot of overlap here. It's the symmetry and ordering type. And that's where you have a need for things to be aligned and balanced and ordered. So you hear this used colloquially a lot when people like straighten out a picture and they're like, I'm just so OCD, the picture has to be straight. Try that times like 500. And that's what real OCD is. They might spend excessive amounts of time arranging items, ensuring uniformity, retracing their steps to maintain symmetry. I'm just reading this off of a site explaining OCD. And that can be distressing. And so they might spend like hours and hours a day rearranging their bookshelf. So that obviously has a lot of overlap with autism. Like one of the early childhood signs of autism can be that a kid arranges their cars by color or sorts things or groups things or counts things. The difference is, and we'll talk about this more with my specific examples, is it distressing? Is the kid deriving enjoyment from sorting things, or is this based out of like a deep set fear and anxiety and overwhelm? There's another example that they give here. The need for symmetry and order can extend beyond physical objects and may also manifest in mental rituals, such as counting or repeating certain words or phrases until they feel just right. That sounds a lot like echolalia, where autistic individuals might say, repeat a noise over and over, say the same word over and over. But again, the difference, echolalia is soothing. It's actually a form of stimming. When we like make a noise over and over, it's because it feels good. Like it's not born from a anxiety that something will happen if we don't. That's the distinction. And then finally, rumination and intrusive thought, OCD. And that's where you have repeated images that are deeply distressing that will play over and over in your mind. They can be violent, sexual, blasphemous. Like there's a subtype of OCD that's a religious type. So someone who's deeply religious might have this image of themselves like committing a sin over and over and over. Or you might have an image of you causing harm to like your child. And you would never actually do it in real life. It's completely incongruent with your values, your morals, your sense of self. But the image plays over in your mind and you have no ability to stop it. It just does it over and over. And you can imagine how horrific that is for the people who are afflicted to have to watch these distressing images play out in their minds. So that's why it's very important that society takes OCD seriously, because it's not just this little like we do with ADHD. People do the same thing where it's like, oh, haha, it's so funny. It's a very serious condition, and the people who have OCD deserve to be heard and deserve to get accurate and prompt treatment. Hopefully this was a little educational. There is a lot of overlap, not just in the symptomology of OCD and autism, but actually in the genetics as well. We have the link to this study down in the description. This is one of several studies looking at the genetic overlap between OCD and autism. Autism is a polygenic inheritance condition. So what that means is that there's not a single gene that controls autism. There are actually many, many, many genes. In fact, this study looks at 624 genes that correlate with autism. And this explains the wide variability of traits that you tend to see associated with autism. When we talk about autism being a spectrum disorder, that doesn't mean that everybody in the world is somewhere on the autism spectrum. That's actually a huge misconception. What it means is that of the people who are autistic, you tend to see the traits exhibited on a spectrum. One person might have a lot of ritualistic behaviors, repetitive behaviors, stuff like that, but less maybe struggle socially. Someone else might have a lot of social challenges and a lot of special interests but maybe less sensory issues that are less extreme. And so autism doesn't look the same between any two people. It's a very heterogeneous condition, which makes it hard to study. That is because there are so many different genes that are controlling it. Based on the type of genes that you inherit, that's going to reflect in your specific presentation. It depends on your special genetic cocktail, like the way that your autism will show up. What they did in this study is they looked at the suspected OCD genes and the suspected autism genes. I say suspected because this whole branch of research is a lot newer. We didn't used to have the computational power to be able to do this type of research. Of the 86 OCD genes and the 624 autism genes, they found 43 genes overlapping. So that means that if you have any of those 43 genes, it may contribute to OCD and or autism. So that's a pretty meaningful amount of overlap, right? And so it tracks that a lot of people with autism end up also developing OCD at some point in their lives. Autism is something that you inherit when you're born with. Like, you exhibit traits starting at the age of 2 or 3. It's very, very early on in life. OCD can be later in life. Reading from the Stanford OCD page, the level at which I'm covering OCD is fairly surface level compared to my depth of knowledge in autism. I suspect that probably the things that I'm saying about OCD are surface level in the same way that an OCD podcaster probably wouldn't have the deepest understanding of autism. Assuming this is all fairly accurate. They say that OCD usually begins before the age of 25 years old. It doesn't have to be, though. The mean age of onset, the average age of onset, is 9 years old for boys and 11 years old for girls. You start to see obsessive behaviors develop, and it's repetitive, or it's a chronic condition for most people. So in their research, they found 85% of people had continuous course, so where it would come on and go in remission for some period of time. From this description, it's fair to say that it's something you're probably born with. Certainly, it appears that there are significant genetic predispositions, whether or not those necessarily develop into OCD. So there's a lot of similarities with autism. But given all this information, how do you actually tell the difference? How do you know if you have one or the other or both? We can take a look at some of the events in my life to help distinguish. I will note I don't necessarily prescribe to the idea that I have OCD. This is not necessarily from a clinical perspective, but from my own self-conceptualization, like my own self-image. I don't tend to use the label of OCD for myself. I think that everything I've gone through is sufficiently explained through autism and ADHD. Now, I don't know if my therapist used the OCD billing code when I was receiving treatment. For our international listeners, a billing code is like a number that your doctor puts in when you're receiving treatment, and then they send the bill to your insurance company, and that code tells them what you were being treated for, and then the insurance company will hopefully help cover your treatment based on the billing code. So that's what that means. I don't know if she used like the OCD billing code or not, or if she would say that I had OCD, but my self-understanding and my self-image is that I did not. But I've had, I think, 3 good examples of behaviors that I have that could be construed as obsessive, but not all of them are detrimental. And that's the key distinction I want to draw here today. OCD and needing to receive treatment is because it is causing a detriment to your life. It's inherently harmful to your well-being. Whereas like repetitive behaviors with autism are not necessarily harmful and may actually be beneficial. So an example of that is like a strictly beneficial obsessive behavior for me is doing research on ADHD and autism. It's something that brings me a tremendous amount of joy, and it's led me to be able to have a podcast like this. It's come in useful because I've had friends talk to me about different things, and I have a really good memory for this stuff. I can be like, oh, I read about this in this study. Let me send you the link. And so it's honestly come in clutch like so many times. But I've had other doctors suggest that it's medical phobia or like health phobia, because I will get off work and then I'll spend 8 hours a day just watching medical conferences. And that isn't necessarily like a typical behavior for someone my age. It could look like, if you didn't understand me and my interests and my psyche, I could see how from the outside looking in, someone might be concerned and be like, oh, she's like so scared for her health that she's obsessively reading research papers and obsessively watching medical conferences posted on YouTube. And that must be so awful and we need to help her. And I'm like, no. Oh my God, this is my hobby. I love that. I enjoy doing that. And I think that there would be a huge hole in my life if someone pathologized that and tried to take that away from me and told me that it was like unhealthy. That's the risk. If clinicians inaccurately identify obsessive behaviors and try to teach autistic individuals to not engage with them, you really have the potential to rip away something that is important to autistic folks. Like when we engage in our repetitive behaviors, it can be self-soothing. It can, I can't overemphasize this. It adds so much to our lives that you can't just take it away. So I think that's an example of a beneficial behavior that other people might call obsessive. Now, that doesn't mean that a beneficial behavior is always good universally. So I also have examples of where my special interests have turned negative, because that's what we call it in autistic terminology, right? It's a special interest. I really got into interior design during COVID. I had to buy a new couch. My cats like to eat anything upholstered. And so I had to find attractive outdoor furniture that didn't have arms so that my cats wouldn't eat it, because they ate the arms on my last couch and on like wingback chairs. So I needed a final couch that wouldn't get eaten. And so I got really into interior design, and after work during COVID, because I couldn't go out, I would just spend like 8 hours a day going through furniture websites. And I ended up learning so much about like design, the history of interior design. Like I can still go into design museums and identify common chairs. Like, oh, this is, a Bauhaus chair from like this era, or this was made by this designer. Like, I enjoyed getting that learning experience. I really enjoyed learning about interior design and the theory behind it and the history. Where it started to take a turn is I think I had been researching sofas and chairs for like, I want to say like 8 months. Like every day after work for hours and hours. And it started to become a source of anxiety. I want to give kudos to my therapist for identifying that turning point, because that's crucial. A hobby that was once happy and joyful for me became problematic because I got to the point where I was like, I can't possibly find the right sofa. There's so many out there. I had gone through every single website so thoroughly. Like, I swear to God, I can point to sofas and tell you who the manufacturer was because I went through so many websites. And I was convinced, like, okay, I'm never going to find the perfect one. And I would come close to ordering one, and then I would be like, no, maybe I can do better. When it started to be anxiety inducing, that's when she noticed, and she was like, okay, we need to cut that off. It's time to order a sofa. Therapists don't tell you what to do, but that was the conclusion that we came to, is like I needed to just pull the trigger and order something because it was interfering with my life at that point. And so that's an example of where a special interest can turn negative. That's where intervention is helpful. And then, of course, the plastic example that I talked about in the holiday episode. I think that's an example that would probably be the closest to OCD if you were to categorize it as that. You could certainly argue that it was an OCD episode. You could make a very compelling argument for that as well, but that's not necessarily the way I view it through my own personal lens. So what happened there is I was reading a lot about plastic. I think this was like, I want to say shortly before COVID. I like to find my life now in like the pre-COVID era, the during COVID era. So I think this was like shortly before COVID. I was reading a lot about plastics in the waterways and how we consume microplastics and how it's contaminating our oceans and just all this stuff in the news about plastics, which again, we're kind of having a resurgence of that. And the good news is treatment for me was effective. I don't feel super triggered when I see those articles that have been coming out lately about PFAS. For folks that are struggling out there, I hope this is a sign that you don't have to struggle forever. Like, treatment works. But anyway, so I was reading, even back then about all the plastics, and I got really concerned. I wanted to protect myself, protect my body, protect the environment. There were a lot of reasons, pick any of them, for why I was trying to reduce the amount of plastic in my daily routine. That sounds good on the surface, but it quickly becomes unmanageable. Think about like all the things that go into your daily routine. And that's when it started to balloon. I wanted to cut it out of my shampoo, conditioner, dental floss, clothing. The list can just go on and on. To give you an example, I'm very good at research. I love researching things, if you can't tell from this podcast. It's one of my things. I needed a new shower curtain back then. Of course, I didn't want to buy a plastic one because that's just a huge sheet of plastic. So then I was like, okay, what about cotton? Cotton is very water intensive and generally requires a lot of pesticides. Okay, what about bamboo? Bamboo is a very renewable resource, but in order to turn like a grass like bamboo into a fabric form, takes a lot of chemicals, and those can contaminate the water. Okay, what about hemp? And so I find a hemp shower curtain, and that's like $80. So then, do you want to buy a shower curtain for $80? And that's just one object, but imagine that level of research scaling to every single item that I consume. everything that I needed to buy. And so it started to become overwhelming. Then simultaneously, when I would go out in public, I would have these very strong reactions. So like when I would see someone throw a water bottle into the trash instead of into the recycling bin, I would feel physically ill. I would have the overwhelming urge to reach my hand in the trash can and pull out the plastic bottle, because I would just like obsessively think about that plastic bottle is going to be in a landfill forever and it's never going to break down. I would be like, wow, I'm a piece of shit if I don't like solve that, if I let that happen. And I'm directly responsible. The only thing that kept me from acting on that was that I was terrified of reaching into a trash can, cutting my hand and getting tetanus, which is a good thing. Like, don't stick your hand in a trash can. People shouldn't do that. And so I would never actually pull a water bottle out of a trash can, but I would have that thought every single time. And I would like feel horrible about myself and feel physically ill. And that would last for a lot of the day after I would see that. And then similarly, like when I would go into a public restroom, if I saw someone use a paper towel instead of the hand dryers, I would just feel so sick. And in hindsight, that's not that big a deal, right? Like, it's paper, it's biodegradable. That's not what's gonna make the difference. But I wasn't in the same frame of mind at the time. And so that was deeply distressing to witness that. And I would think about that a lot when I would see that in public. My therapist noticed that these were challenging behaviors these were challenging things for me. And we talked about it. What we did is something called exposure response prevention therapy. This is a really common therapy that is very successful for treating OCD. And what it is it's where you slowly build up to exposing yourself to the things that cause triggers. So for me, that looked like using the paper towels instead of the hand dryers, or throwing something into the trash instead of into the recycling bin. And at first that was really challenging. Like, I felt pretty horrible about myself. But over time, it became better and it became more tolerable. And I was able to kind of let go and regain control over my life. I don't feel super triggered anymore when I read articles about PFAS in everything. And I'm able to engage with it in a healthy way, right? So I can be like, okay, if these are the biggest contributors of PFAS, I'm going to eliminate that and nothing more. I'm only going to go after the big fish, and then I'm able to stop. That really speaks to the success of exposure response prevention. Another kind of example for how ERP works is like if you had an overwhelming fear of swimming pools, the way your therapist might go about it is on the first week, you would drive by a swimming pool. That's it. And then the second week, you might go and sit on a pool chair next to the swimming pool, but never get in. Then on the third week, you might dip your toe in. The fourth week, you might go wading around in the kiddie pool. So it's like ankle deep, and so on and so on. And so you work your way up. So I think the good news about ERP is that it doesn't necessarily matter if we're sitting here trying to define the difference between autism and OCD. That is kind of a human construct anyway, right? Like, I don't know that in some instances there may not be a meaningful distinction from like a biological perspective. Regardless, ERP can really help you. If you are a person struggling with detrimental, repetitive, or obsessive behaviors or thoughts, please know that there is treatment out there. It's very well researched. It's very effective. And so there is a way to help yourself feel better. Bringing back to the autism versus OCD discussion, I think the biggest takeaway for clinicians is to really listen to what your clients are saying and the way in which they talk about these repetitive behaviors. If you don't see any signs that these things are causing them distress, like if it's something that they engage in repetitively, but it brings them joy, let them do it, because it can actually be really detrimental if you pathologize those behaviors and tell them that it's unhealthy or abnormal. And even if it seems weird to you, it might not be weird to us. It might actually be an interest to us, and it might be something that really does bring us joy and is a part of our identities. Like, I don't know who I would be if I didn't do research on ADHD and autism all the time. And equally, even though the interior design thing helped, even though that was it created anxiety for me at one point, it still is a part of my identity, and it's still an interest of mine. And so I still care deeply about it, and I know a little bit better now where that line is when it becomes unhealthy. And similarly, even the plastic thing, it's still something that I care about. It's not something that's completely incongruent with my sense of self and my personality as a whole. I just needed to understand how to engage with that urge in a way that is healthy and sustainable and doesn't become overwhelming. That is the true benefit for clinicians, to help us find ways to engage with these things in a healthy way without causing distress or harm to ourselves and to others. So again, to reiterate, folks, if you are struggling, please get help. There are resources out there for you. And I really hope that if you're going through something similar, that my stories were relatable. I hope that you can take something away from this. As always, if you have any tips or anything you would want to share, please let us know in the comments. We would love to hear from you, and we would love to hear your stories as well.